The information provided in this video presentation is strictly only to be used in conjunction with the advice given to you by your treating physiotherapist. What is lumbar disc pain? The lumbar disc is a pain-sensitive structure that is easily damaged or inflamed with day-to-day activities. The disc sits in between each individual vertebra and consists of an inner nucleus and an outer annulus. The annulus can get damaged with repetitive postural stresses such as bending forwards, stooping, lifting with poor technique, prolonged sitting, especially with poor posture, and as a result of weak core musculature. If we look at a cross-sectional view down on the disc, we see a normal outer annulus on the left and a damaged one on the right. When the annulus bulges or tears, the contents can impinge on the nerves and even cause sciatica. This cross-sectional MRI shows disc bulges at L4-5 and L5-S1. The lumbar curve, lordosis. The normal lumbar curve is a shallow C shape called the lordosis. Any movements or positions where there is a flattening or reversal of the normal lordosis may potentially cause damage to the lumbar disc. This is because there is immense posterior pressure applied through the disc when the lordosis is lost. As the inside of the disc is a bit like jelly, bending forward increases intradiscal pressure, as can be demonstrated by this picture. As you bend, the disc opens up from the back, causing an increase in pressure. As a result, most disc injuries are suffered to the back or posterior part of the disc. The most common levels affected by this are L4-5 and L5-S1. How is the lumbar disc treated? The most important thing is to stay away from movements or positions which aggravate the disc. These include bending forwards, stooping, or lifting incorrectly. Slouch sitting and sitting of any kind for long periods has the same negative effect on the disc. This slide shows how disc pressure increases with these movements and/or positions. The other most important factor in treating discs is to perform activities that assist the disc in its recovery. If you must sit, sit upright and for short periods only. Use a lumbar roll to assist in the maintenance of a normal lumbar lordosis. They have a special curve that helps to support the lumbar spine. These lumbar rolls are available at all SSPC branches. If you must bend, bend from the knees, not from the back, and maintain a straight back and lordosis at all times. As this picture demonstrated the negative effects on the disc of bending forwards, it also shows the positive effect on the disc of bending backwards. If applicable, your physiotherapist will give you back arching exercises to assist in reducing pain and improving lumbar disc mechanics. As you progress with these exercises, core strengthening may also become an important part of your rehabilitation. These back arches can be performed in lying on a hard surface or in standing. Walking can also be extremely beneficial, but your physio will advise if and how much to walk. Timeframes when treating lumbar disc problems are often difficult to give due to the variability in damage and inflammation to the disc. Research has shown that the vast majority of discogenic problems will resolve in 2 to 4 weeks. The minority are usually the more severe prolapsed discs, some of which may end up taking up to 12 months to settle, whilst others may go on to have surgery. Prevention is the key, and you should speak to your treating physiotherapist about preventative exercises such as Pilates. For all further advice, please contact your physiotherapist or email us through our website on www.sspc.com.au.